Well, another conversation that plenty of people are having too is about this condition that affects at least 1 million Australians, causes crippling pain and infertility. But so many people with endometriosis suffer in silence for fear of being disbelieved or misunderstood.
The process of diagnosis can take months and treatment options are limited. Now, groundbreaking new research could end the suffering for so many women.
Dr. Fiona Cousins is a research scientist within the Hudson Institute's Women's Health Research Group, and she joins us now. Good morning to you, Doctor. Can you explain to us what endometriosis is and what causes it?
Yes, so endometriosis can affect anyone who was assigned female at birth, so that's predominantly women, but also non-binary people and trans men can also suffer from endometriosis as well. And symptoms can start from the onset of your first period all the way through until menopause. And it's defined as the presence of endometrial-like tissue, which forms lesions on organs within your pelvic cavity. So how do those lesions get there? Well, during menstruation, what happens is your endometrium is shed from your uterus or your womb, and that can pass out through your vagina. But also some of your tissue can go backwards in through the fallopian tubes and into that pelvic cavity, where it can attach to body organs such as your bladder, your bowel, the uterus, and the ovaries, and form these really painful lesions. But what we don't know is why some people get endo and some people don't, and that's what research scientists like me are working on.
Hey Fiona, what's the treatment process right now and what are your thoughts on it?
Yeah, look, it's not ideal at the moment. There's very few options for people that have endometriosis, so they can be given painkillers to treat that chronic pain and inflammation that they have, and they can also get put on hormones, so something like the contraceptive pill, and that stops further menstruation into the pelvic cavity and also tries to slow down the growth of those lesions. But unfortunately, it doesn't actually remove the tissue itself. The only way to get rid of it is to go through laparoscopic surgery and have those lesions cut out. And unfortunately, many people have to undergo many surgeries over their lifetime to keep getting rid of their lesions because they keep coming back. So better treatment options are needed.
Well, you are working on one of those right now. Tell us about that.
Yes, so I'm looking at a non-hormonal, non-surgical treatment, and we're looking at a newly discovered cytokine. Now, a cytokine is just a fancy word for a secreted protein. And this cytokine has known properties, so it can regulate cell growth and also regulate the immune system. Two things that we know don't work in endometriosis. And at the moment, we're just in preclinical testing. So we have to tick a lot of boxes as scientists before we can get to a clinical trial. But our preclinical data looks really encouraging. So hopefully one day I can come back and talk to you about it when we're at that clinical trial phase.
Sounds good to us.
Yeah, fair enough. The process of diagnosis can be long and traumatic. Another one of the things you and your team are working on is this non-invasive diagnostic test. What does that look like?
Yes, so for anyone who doesn't know, the diagnostic process can take up to about 7 years for endometriosis patients, which is just staggering. And that's because there isn't a good non-diagnostic test for endometriosis yet. And so the only way to really say you have lesions is to go in and look via surgery. We are getting improvements in ultrasound, so we can detect some types of endometriosis, but not all of them. So that is why we're looking on that non-invasive test to try and complement that ultrasound imaging. And so we're actually looking at using menstrual fluids because it's a waste product and we can get our hands on it quite easily. And we want to separate that down into its components and look to see what is different between people with and without endometriosis. So in the future, you might go for your doctor and instead of getting a pot for a urine sample, you're given a pot to put your menstrual sample in and that will get sent off to a pathologist.
Well, it's a lot less invasive, isn't it? Dr. Fiona Cousins, thank you so much for your time this morning.